Last, certainly not least, we've heard from Eric Luptemeyer in the past. He's been a frequent speaker and attendee here. Eric, he's a seasoned operations and financial executive. He's got a proven history of strong leadership and a reputation for effecting business turnarounds, realigning business strategy, and reorienting executives towards a new mission. Throughout his career, Eric has exemplified a principled leadership style with a focus on operational success and financial controls. With over 23 years of experience in building and developing physician business models and creating distribution channels by replicating proven methods while building scale into the operation. Sounds like McDonald's all over again. Eric has experience in growing developmental stage companies, securing growth capital, implementing controls and corporate governance while focusing on a principled growth strategy. Welcome, Eric Luptemeyer. And Eric, you're going to lead us to the end before we get to questions. Financial health, pretty important, not just the physical body, but those providers need their financial health and wealth as well.
Okay, good morning, everybody. I think this has been a good segue into some of the challenges that everyone's facing in 2014, all the compliance issues, the risk management issues, the training issues. Just for my own edification, who, as a show of hands, who in the audience is a licensed practitioner? See one? Who represents a licensed practitioner in the audience? Okay, all right. Just curious, wanted to see who I was talking to. 2014, as with years past, is going to present new challenges, false starts, empty promises, and a lot of heartache and heartburn inside of individual practices. I think that one of the key things to moving forward is going to be, for any individual physician, they need to understand their existing business. More than what am I going to accomplish this year, what are my goals, they need to understand their existing business. What's their baseline? Because they have to understand the threats and weaknesses that they're going to be faced with, their strengths, their key performance indicators, areas for improvement, and opportunities for growth. These are just some threats to the existing model as I see them. I've been doing this about 25 years. You've got the regulatory compliance issues. Office administrators and physicians today are inundated, and they don't know which way to turn because there are false starts because of Congress not acting or pushing it down the road. The increased administrative burdens on your existing administrative staff. The Kaiser Foundation did a study last year that said most office managers spend 30% of their time on compliance issues. So the administrative burdens of being a physician in today's climate it's cumbersome, it's burdensome, which turns into decreased patient flow, which turns into decreased cash flow, and they have competition and consolidation threats because of the new Affordable Care Act. The Affordable Care Act is, in my opinion, one of the craziest models I've seen, and I've been doing this a long time. It completely takes the gloves off from a regulatory perspective. The legal restrictions that you would typically see in a group setting is gone. They're not subject to Stark laws. They're not subject to self-referral laws or anti-kickback laws, which means that the big boys are coming to the table, and we're looking at massive consolidation. Something that we haven't seen since the early 90s. So that's what the ACO model is set up to do. And you'll likely see some patient attrition through third-party payer changes. United Healthcare just dropped 55,000 physicians across the country. And more are following suit because they don't comply. The plans that they were selling, they don't comply with the Affordable Care Act. So if you're a physician and you think that you've got a full patient load, you're going to lose some patients because you will no longer be a part of that network. Okay. My suggestion would be to get the management team together and have an open dialogue about your existing strengths. Where are your strengths? Do you have financially beneficial contracts? You need to review each one of your contracts, understand the matrix, understand the fee schedules, understand who's a better payer and who's a bad actor. Do you have a consistent message? are all of your people, from the front to the back, are they singing from the same sheet of music? It's really getting everybody lined up and pulling in the same direction. This is a bad analogy, but I like to use the wagon analogy. I'm dating myself. I look at every business model, whether it's a medical practice or renewable energy company or whatever. I look at the business model as a wagon. And every day, you've got people pulling the wagon, and you've got people pushing the wagon, and sometimes you've got employees that are having a bad day, and they're walking next to the wagon, but you're always moving forward. And then you've got some employees that are sitting in the wagon, and everyone else is pulling their weight. It's time to get rid of those employees, and everyone's pulling in the same direction. What's your market reach? Understand your market reach. Understand where your patients derive from now. Have your office manager or your billing person run a report, pull the zip codes, understand where they're coming from. Can you expand? Do you need to concentrate more in certain areas? And is your patient base happy with your practice? Believe it or not, in today's day and age, you have to keep your patients happy because they're very vocal with this new thing called the internet. And they like to go on, all the health grades and the rate your doc, and they like to tell their story. And it's unchecked and unbalanced. It could be a competitor. It could be a disgruntled employee. It's anonymous. It doesn't have to be that particular patient. But if you do have a patient that has a problem, get in front of it. Fix it. And the only way to deal with the negative is to flood it with the good. And like Bernadette was saying, in her experience at checkout, they were having her do a survey. And that survey is probably going to get posted on rateyourdoc.com in addition to the patient portal, because you're going to push out all the good data out there so that you have a good presence on the internet and a good reputation. Where do your referrals originate from? Find out who your referral sources are, understand them. Is it certain groups? Can you go out and get more referrals? Because you're going to see a dip in patient flow. These changes it's going to slow the process of medicine down, and slowing the process down is going to decrease your cash flow. And I don't know too many physicians that want to change their lifestyle. So we have to find ways. To make it easier for them. And is your staff cross-trained? God forbid someone gets hurt, an injury, or they're out for a period of time. And every office that I've seen is running very lean right now anyway, because of all the extra burdens that they have. Make sure that they're all cross-trained so that they can pop into a space. Otherwise, you're going to see a dip in cash flow and productivity. All right, key performance indicators. Most practices that I consult with, they measure their success based on how much cash they have in the bank at the end of the month. And that is a really bad way to run your business. You need to understand the things that are important to your business. Understand your insurance mix, their relative value to the whole picture. You want a diverse mix. Understand your average revenue and receipts per visit. So you know how many patients a day you need to see just to break even, and what does it mean if you see more. Cancellation no-show rates, if those slots are empty, they're gone forever. Sure, you may see that patient again in the future, but they're taking up a slot that it could be a new patient. So really develop internal policies to track that, measure that, and make sure that obviously the slots are full. Your average DSO, days outstanding. I don't know how many people are familiar with it, but days outstanding is basically how many days is it going to take you to collect for a service you performed today. The national average is about 50 days. Of course, that's decreasing with electronic filings. You would want high teens, low 20s. And if it's above that, you're going to want to drill down and understand why. Do you have a denial problem? Do you have a clearinghouse that is holding on to something and it's not clearing in time? Provider contribution to monthly results. If you're a solo practitioner, that's easy. It's all you. The world is on your shoulders. If you're in a group setting, you want to understand an individual profit and loss statement for each provider. What are they bringing to the table? You want to share that with them. And you want to develop internal and external reporting. Most of the canned reports that come out of existing platforms, they're high level, but as an owner, or as a physician, you're going to want to understand the most finite level of detail that you can. So you'll probably develop internal reporting packages for that. I develop custom reporting packages for all my clients because I think it's important. They can't get what they need out of their existing system, and this gives them a way to track it and measure it and review it monthly with management. Operational improvement. In order to improve the operational results of your business, you're going to want to ensure administrative teams are cross-trained, like Bernadette said. I know we're trying to wrap up. Weekly and monthly meetings, like she said, it's critical. It's a chance to have an open dialogue in a forum, and the owner or the physician is going to define the vision and the objectives, and it's up to the team members to meet those objectives. Train your staff, make sure they understand what the vision is, what's that point on the horizon that we're all going for. Delegate and follow up, and do not be an absentee owner. I can't tell you how important this is. Most physicians think, I just want to see patients, and I hired a team to do this. But if they're not involved, it doesn't get taken care of, I promise you. Okay, financial improvement. In order to improve the financial results of the business, the existing business, once you understand the baseline, you want to define variable versus fixed expenses, renegotiate all material contracts, every one of them. You can't renegotiate rent, but everything else is fair game. And you'll be surprised how fast 5%, 10% adds up over the year. I just renegotiated all the vendor rates with a group out of Birmingham, Alabama, and we dropped an extra $110,000 to the bottom line every year, and they don't have to see an additional patient. It's low-hanging fruit. I'm telling you, it's out there. Some practices that are really buttoned up, that do a very good job, you have to climb a little higher for the fruit, but it's there. Look for alternative add-on revenue streams. You're going to look for passive income. Define your top 10 payers. Renegotiate all your reimbursement levels. Define your top 10. You'll renegotiate with all of them. You won't get all 10. It's a process. You may get 3 or 4, and you'll be doing well. But if you can add an extra 30 to 40% on your existing contracts, you're getting paid more for the same patient load. Historically, physicians, the only way to make more money or be more profitable is to see more patients. It's just a multiple effect. But if you renegotiate better contracts, you're getting paid more for the same load, and then you can decide whether or not you want to increase that load. You want to diversify your practice with cash-paying platforms. Look for retail opportunities. They're out there. There's plenty of them. Create and monitor your key performance indicators internally, daily, weekly, monthly, quarterly, annually. Review them with the staff. You want to create internal and external reporting, including break-even analysis and budgets. Believe it or not, budgets are critical to this, and you want to compare actual results to budget, and you're going to make changes as the results. All right, some quick alternative revenue streams for growth, additional modalities. Your biggest asset as a physician is your license hanging on the wall. Your biggest asset as a practice owner is your distribution channel, your patient base. How many more revenue streams can you layer into that existing captive audience? Research revenue, there's plenty of companies out there that will pay you for studies. Create your own group purchasing organization, billing and collection agencies in-house. A third-party billing and collection agency is going to get more or garner more attention from a debtor than your office will. Create your own. Make it a third party. Telemedicine. This is trending. This is a huge trending line, and it's very exciting because it's going to change the doctor-patient relationship. And there's opportunities out there for retail type of revenue for a physician that is almost passive. Adding other licensed professionals, if your current location can accommodate it, I would recommend mid-level providers. That's changing too. Adding strategic satellite locations or office shares. You want organic or acquisition-oriented growth. That's going to be dependent on the individual physician, what they want to do, what their risk tolerance is. Acquisition-oriented growth is less cash-intensive. Organic is more cash-intensive, but it depends on the individual. And there's plenty of people, I can see one right now out in the audience, that can help physicians grow. Okay, trending. This is where it's headed. Hospital and carrier ACO participation is growing rapidly. 15 hospitals in Vermont just joined forces. 2 hospitals in Utah control 85% of all healthcare providers in that state. Like I said, it's massive consolidation. ORMC purchased a local ACO for $50 million that had been in practice for 6 months. All the carriers are getting in on it too. One of the other issues, Google just, over the last 6 months, has purchased 8 robotics companies. And in Asia right now, robots are treating patients. It's coming. Retailers are getting in on it. Walmart, Walgreens, they're getting serious about the delivery of retail healthcare. All right, so what's next? Define it, track it, measure it, improve it, enjoy it. My sincere suggestion is that if you are faced with these challenges and you want to grow your business, seek the help of a professional. Everyone tells physicians to do Medicare audits, RAC audits internally on the clinical side. No one ever focuses on the business side. And physicians are trained, obviously, to be physicians. And no offense to the physician base, most of them are not stellar business people. And so they need someone to come in and kind of define it for them, give them the roadmap so that they can enjoy their career cycle. And that's it for me.
Let's give it up for Eric.